with C-section, you don't sleep. They just numb these parts.
Yeah.
So when he start cutting, I could feel pain. Like, yes. I could feel even how he put his hand in me to grab the child. When he grabbed the child, now they have to put the child. I screamed because I could feel that pain.
Hi guys, welcome back to my YouTube channel. I have been missing for a bit, but I'm back, and I'm back with a guest again. This is my big sister. And she's here to speak about the possibility of death in pregnancy. I think that is something we don't really speak about. We speak about like the operation part, we speak about wanting to conceive, the fertility, we speak about all those things, but we don't really speak of the possibility that you could actually die while giving birth or after giving birth. So my sister, she almost died after giving birth to her last born, and let me tell you how stressful that was for her, especially, and the rest of the family. So that's why we have the segment here where she gets to speak about it in detail and try to just give people the info about it and raise awareness, hopefully. And the other part where she's gonna touch is how long it took her to actually have a child, because women, we go through things, eh?
Go through a lot.
But I'll let you introduce yourself first of all. Can you see how comfortable I am when I'm with my sisters?
My name is Fanny. And I'm turning 41 this year.
This lady looks like she's 41. Like, it's stressing me. We look with the age mates.
I'm turning 41 this year.
Forever young.
Yes. And we thank God for life. Yeah. Because like when it's come to conceive, I don't know why people before I conceive, I didn't know better.
Yeah.
Sometimes we go through unnecessary stress, like because I see my friend already, she's got a child, and me, I don't have. Then I'm stressing why, it's
do you feel you went through that, like people around you started having babies?
Yes.
And then you still waiting for God's promise?
Yes, because the other part was like when you hang out, like I'm married, I'm hanging out with people who are married. So like sometimes there's this topic just pop out about kids, start talking about kids. This one will tell you, oh, my child does this, and others will be nice, like no, they don't really want to
go deep
through it. They know that there's somebody here who doesn't have. Others, they just don't care, like and sometimes when you try to speak, they're like, no, you know nothing about kids because you still don't have kids, and you know how that is bad.
It's crazy.
It's like they just put you off, like, what do you know?
Yeah, like your opinion doesn't really because you haven't had experience.
Yes, you don't have any experience, you know nothing about kids. So it was a bit hard for me. But I was still going on. Like, I was stressed, but if I knew better then, I don't think I'm supposed to stress myself. Yes. Like, I'll beat up myself. Like, I want also a child. I want a baby. Go through this. Sometimes you go through. You go to the doctor.
How often did you see the doctor?
Like,
so many times.
So many times. The crazy things. It's like it's nice when you go to the doctor and then maybe they check you and then they say this is the problem. Then when they check you, they say you're fine.
Sure.
There's nothing wrong with you.
But yet you're struggling.
Then you're wondering, so how? I'm fine. Why can't I get pregnant? And other things, sometimes as we ignore, it's like when they talk about in relationship, when there's this thing, people always see women.
Yeah.
They don't see men.
Especially African.
Yes. And let me tell you something. In this thing, most people with problem, it's men.
But who's gonna talk about it? Who's gonna say I'm gonna go with my husband to get him checked because I know I'm fine?
Men are stubborn. for them, they believe them, they are fine. When it's come to this issue, it's just a woman who has a problem, you know. And to convince a man to go with you, it's not easy.
Fanny, do you think it's pride, or do you just think a man just thinks I have that capability of making a woman pregnant, so the problem lies on the woman? Or do you think it's just pride?
I think
their ego.
It both. You know, there's that pride, like, I'm a man, you know.
Of course I can get anyone pregnant.
Yes, I can. And there's that, like, why must I go? You know, no, if there is a problem like this, it's a woman, you know. So it was that, like, it was a bit difficult. I don't want to talk about everything right now.
Yeah, no, please.
Yes.
But do you maybe want to share how long it took you?
It took me like 10 years.
10 years, guys.
Yes.
As I always say, like, God's timing, like, you'll never know.
Yes.
10 years is a long time.
You know, sometimes we keep on, like, maybe it's not even us, maybe it's just God's time. Maybe the time that you want, God is not ready to give you, maybe because you're not ready as well. You know? And then on God's time, I don't think there will be anything that you force, because God always does everything perfect on His time.
That's true.
Yes. So it took me long, then eventually it happened. And
3 kids later.
3 kids. And when it happened, I couldn't believe. It just happened.
When my sister started popping babies.
Like every
year. Popping them every year, back to back.
Like really, it was something very beautiful. I remember when first time I went to see a doctor, like I just did things change in me. Like I've got this pain, like it's like I want to see my period, but it's not coming. But okay, fine, I know it, because for me I was like, no, I can't have babies. You know, there come a time when you
did you actually convince yourself that
yes,
I'm a barren,
because I was like, you know what, I'm not gonna go through this stress again. So I just conclude, like, you know what, if God did say I'm going to have a child, I'm gonna have a child. And if in God's plan it didn't see me that's as a mother, I'll no matter what I do.
Yeah, but that's a hard pill to swallow for anyone that wants to be a mother.
I
so
know.
Bad.
But you know, before it was a bit difficult, but I think now with technology everything is possible. You can try.
Yeah,
you know, there's so many options right now, but back then there was, but it was not like now. So for me, I just conclude and say it's okay. I accept the fact that I can't have babies, you know. It's okay, it's fine, let me just live my life. I forgot about that. I was happy, you know. I was happy. Life goes on. The next thing, I find myself like, you know, I've got this pain. So for me, I'm like, okay, fine, because anyway, when I have my when I'm on my period, I always have this pain, so it's okay. The next thing, my husband was like, you even snoring, like, because the way I know myself, no, I don't snore
like a man.
Like, you come back from work, when you just lay down like that, you're gone. And I'm snoring. I'm like, no, this is not me. Sometimes you can feel when you snore. Yes,
physically.
Yes, you can feel like you deep sleeping, then like
those times that wake you up.
Yes, like, no man, am I or not?
Yeah,
I am. Okay. My husband was like, no, we're going to see a doctor. I went to see a doctor. Then when I went, I'm like, no, I'm not just feeling well. I've got this pain and everything. Then the doctor said, no, the first thing we have to do is to check if you're pregnant before we do other things. I'm like, me pregnant? From where?
Are you joking?
I was even laughing like, no. Anyway, since you say you have to, then it's okay. He did the test.
Were you nervous? Or
really.
Just like
I was not,
test?
You know, I was not nervous. I was just like, because for me, I'm not pregnant. It's just I've got pain, and it's normal. So okay. Then when he came, he say, congratulations. I look at him and say, for what? Then he said, no, you're pregnant. Say, me pregnant. No, maybe you make a mistake.
Wow.
It's like, no, you're pregnant. For a moment, I was just like, quiet.
Wow.
And then the next thing, it was tears start flowing. I couldn't talk anymore. Then it was just tears. The doctor got scared, like, okay, is it wrong?
Did I give her bad news?
Yes,
or
what is happening? Then it's like, okay, let me call your husband. He went there and like, can you come in? My husband like, what is it? No, she's crying. I don't even know why. I don't know what to do. Then my husband said, why? Say, no, I just found out that she's pregnant. My husband was like, that is good news. Then it's like, no, it's not. Like, she's crying. This is tears of joy. You know, I cry. I was smiling. Like, you know, when you cry and smiling at the same time.
I'm sure you're like, this pain can stay.
You know, the thing is like, you know, they tell me that, okay, I cry, I smile, and it's fine. But then I didn't believe. You know, like now and then you check, is it true? Am I pregnant? Oh my God, it's...
Did you start checking for the bump the same day?
No,
did you go back like...
Not the bump. Every time, like, now, I don't know if it was in my head. It's like now and then I have to go to the toilet to pee. It's like the pee, even, you know, I don't know. It was in my mind.
Have you noticed, like, as soon as, like, that pregnancy comes positive, your body's like, okay,
change.
Let me switch to pregnancy mode.
Let me tell you something. That was not pregnancy mode. It was fear.
Oh, really?
Yes. Like, is it true? Maybe my periods will come. Like, I go to the toilet and pee, like, okay, there's nothing. So it's true. Okay. I sit a minute, I'm like, oh, this pain is too much. Maybe my period has come. I check just like that. Until my stomach starts
coming out a little bit.
And then one day, maybe I was like almost 3 months. Then I felt this movement. I don't know how to explain. I think it was the first time maybe where my baby moved.
Yeah.
I don't know, like electricity, like something shocked me. It's like, you know, I don't know how to explain it. And then I was like, oh, okay, what is happening? Then I think at that moment it went, now I stopped these crazy things in my head, like, let me go check, is my period coming or not? Yeah. And then I did accept now that, you know what, I am pregnant.
Yeah.
I am pregnant. And then, you know,
oh, and she was so dramatic. She was so dramatic.
Too much.
I'll tell her story another time.
Yeah, that is a story for another day. And then so that was baby number 1.
It was baby number 1. And how was delivery baby number 1?
It was not really bad, let's say.
You had a natural birth, C-section?
I had a natural birth.
Okay.
Yes. Like, since I didn't know nothing about birth, my birth was a bit different. Like, one day I wake up in the morning, it was like maybe 2 weeks before I gave birth, or 3 weeks. Then I wake up in the morning, I went to shower, boom. Like, okay, a clot of blood came out, man. I panicked, like, okay, what is happening? Then I called my husband was like, oh, it's that time, let go, start paying, because I did already pack my bag, let go. And then I'm like, no, let me call my aunt and ask, can't just go like that. When I call her, she's like, are you in pain? I'm like, no. Then, no, it's fine, just stay a little bit. And
oh, she told you that?
Yes, stay a little bit and wait. Then I stay. In the afternoon, I start
panicking.
You know,
I'm so dramatic.
I was, but no, when she told me, no, cool down, it's fine. It's not time yet, but and you don't feel pain. Just wait a little bit and see if it will still come. Then later on, it was coming, and then
blood still.
Yes, coming, and then I was having now some pain. Then I'm like, no. Then I call her, she's like, no, now go to the hospital. When I reached there, they check, they say, it's not really time, but where does this blood come from? So we have to admit you and put you on the drip.
How many weeks were you already?
I was, I think, 37
weeks.
37. I think. Yeah. So they say no, we have to induce you. Yeah, because now the blood was coming like a lot. Yeah, it's not the moment. So, and okay, they start inducing me. I hate that thing. It's painful, eh?
Yeah.
Natural birth is good, but when
it's not for child's play.
Inducing, no, it's not child play, I'm telling you. So, and later on, like that day I slept in the hospital. The next morning, then I started having so much pain. I was in so much pain anyway, and then I never experienced this thing of like water break with all my kids.
Oh, really?
No.
Oh, so they had to break it for you?
With even with my second, they're supposed to have a natural birth, but I never experienced this thing of water break. So even with my first child, I was there until how do you call this English? The bits difficult.
What's the word?
Call, when the call is opening, how do you call it? Yeah, so they check me, they say I am anyway before you give birth must be 10 centimeters, but it's 9 also you can. It depends, they say I'm 9.5. The doctor came and say, oh, you have to break this water. Then they break the water. When they break the water, the pain was like severe. I couldn't. Then they take me in labor. The next thing, I'm trying to push here. It was difficult for me. And then the nurse have to help me, like push my
I don't even want to picture her. This is romantic.
No, it was like natural birth. It's not easy. I can't explain that pain, but it's something. I don't know how to explain it. Yeah. Okay, the nurse was like push. I'm like, no, I can't. So she helped me like push my stomach, then boop, the baby came out. And
so cute and chubby.
That thing, I don't know how to explain.
But
I just say.
But for 37 weeks, so she was chubby.
Yeah.
How many kg was she?
3.2.
3.2.
Yes.
Ah, no, she's big.
Yeah. So now, like, God is amazing. The way that pain disappear, it's like in 1 minute I was in pain, the next minute
everything is
fine. Gone. That I don't understand.
Yeah, I always hear that. Eh?
No, I really don't understand. That is, it's a mystery. God mystery. Yes.
Yeah.
Now, second time when I get my second baby. Okay, it was okay. I thought I'm gonna have a natural birth
again, yeah.
Because they have to induce me again, because that one I went over 40 weeks.
Oh yeah, I remember.
Yes. So when I reached, the doctor saying no, we have to induce you. And then I slept in the hospital. The next day I wake up, it was like the pain now was too much. Okay, and then the pain was too much, like too much. I started losing my mind. Remember, my husband can't speak Swahili. Then I was speaking Swahili with him. Like, I'm telling him things, then he's just looking at me.
Swahili?
Yes, in Swahili, because he doesn't even understand what are you saying, And
are you serious?
Yeah, that is, the pain was unbearable. I say no, I'm going to the toilet. I went to the toilet, start pushing. This nurse came and said, you want to kill your child? You can't do that, because remember, just the way I told you, this thing, as we call it, call. I don't know the word in English.
I'll look for it. I'm also not too sure. I'll look for it and I'll just put it down.
So he has to open until 10. Mine was stuck on 5 and no 6 5. No 5 6. 5 6. So like I can't. It's too small for the baby to come out. Then okay, fine. Yes, the pain. It was too much. The water also couldn't break until they have to break the water. And then now my husband was worried because the pain was too much. Like I was becoming so now aggressive. Like I've got too much pain. I'll pull him, like, just maybe massage him or do something. I'm tired, things like that. Then the doctor was like, okay, they called the theater to check if the doctor were there. They say no, prepare, we're sending somebody. Okay, and then I was crying. This nurse keep on telling me, no, you'll be fine. The minute they inject you, all this pain will disappear. So I went there, they inject me, and then the pain just disappeared like this.
Just like that?
Yeah. Wow. The next thing I gave birth was a boy. I was happy. I forgot
all the pain.
And I was just like happy. And then with my third baby now. it's when now it was like, oh, so much that thing left me with the memories, like bad memories. Because all my babies, I got them by it's a government hospital. I remember with this one, I told my husband, I said, no, you know what, I think let's get medical aid, because with those experiences, it was not that much, but you could see it wasn't nice. Like,
it's not the best conditions for pregnant women or a newborn.
I don't want to give birth anymore to government. My husband was like, this thing we believe, like, you know what, with medical aid, we keep on paying, we don't use it, and then the next thing, we just keep on paying, then we don't use it, like wasting money. So no, fine, you're gonna give birth date, you'll be fine. I was like, my heart wasn't like happy. I was like, no. I've got a bad feeling. Okay, fine. When it was time to give birth, because my second child was C-section, so the third one, they say no, I'm gonna give birth again by C-section. So they booked me. Fine. When it was that day, I went to the clinic. The doctor said, no, you must come tomorrow prepared. You sleep. They will do the operation in the morning. Okay, fine. That night, it was on the 11th that I suppose, no, 10. My booking was for 11. I'm supposed to give birth on the 11th of July, 2018. So I have to go to the hospital on the 10th and sleep over. So I prepared my bag. We went. My husband left me. Okay, when I went there,
were you nervous?
No, I wasn't. So because I knew I was, with my third child, I was prepared. I know what was going to happen. So I was cool, I was fine, and I was happy. Like, I was excited when I gave birth. All these things, yes. So I was happy. When I reached there, this nurse like, no, there is that paper you have to sign, okay? When you go to the clinic, they have to give me to sign. But if they don't give it to you at the clinic, they will give it to you at the hospital. So when I reached there, they look at me, what is that paper that you have to sign? I'm like, they didn't give me. Okay, I can't take it by myself. They have to give me. So since they didn't give me, there was no way. And then I'm like, no, they didn't give me. Then they like,
I'm sure that's when the attitude started.
You must go back home since they didn't give you. I was like, what? But my name is on the list of the people who's going to have operation tomorrow. Like, no, there's nothing you can do. You must go back home.
No way.
Just like they send me back home. So, okay, I told my husband, I said, no, they say we must go back because I didn't sign. But those people were there, I could see, but it's just, they didn't want to give me. Okay, fine, I went back home. In the morning, I went back again to the hospital because I used to attend the clinic at the hospital in Southern. I went. So the doctor saw me and like, what are you doing here? Your name is on the list of people who's supposed to be operated today and you're here. I'm like, no, I was there yesterday. The nurse sent me back home. They say no because I didn't sign the paper. Then the doctor was like, what? Which paper? They have those papers there. Why they didn't give you? I'm like, I don't know. Then the doctors called some staff there. They came and then it's like, where's your bag? I'm like, no, I leave it at home. Yeah. Like, I call your husband to bring the bag. I call my husband, they brought the bag. They prepare me. And then, the way they always do it, put the drip and everything. They put me in that.
And that was on the 11th
On the 11th of July. So I was waiting there in the bed. And then now around, I think, 3. No, not 3. I think 5. It was winter. It's a bit darker. 5, it starts becoming dark. The doctor came and looked at me and say, this one, I'm not going to operate her. She's going back home.
Well, for what reason?
I don't know. Just like, no, I'm not going to operate this one today. She must go back home. I was surprised.
Was that a male doctor or a female doctor?
A female doctor.
Wow, that's crazy.
Yeah.
How can you, a woman, see another woman in pain and say no?
And I don't know how they call this thing. They call it sonde. The one they put tight so when you pee, the pee goes in the sonde. Yes. They put already the sonde, they put the drip.
Don't tell me they had to remove it.
They have to remove it because they make me ready for the operation. Now they
removed it and
sent you back home. Know that thing, how painful it is.
It's so uncomfortable.
They remove it, they remove everything. Then she's like, no, I'm not gonna operate, she must go back home.
That's crazy.
It's another second day of sending me back home. So when do I come? No, you're coming tomorrow in the afternoon on the 12th of July. I'm like, okay, fine. We went back home. Now I start getting worried, like, what is happening? This is the second time they send me back home. Okay, I went home, prepare again. The next day, come back again. Come back, I have to sleep over in the hospital. In the morning, I wake up, they came prepare me that my operation is supposed to go on around 11.
That's on the 12th?
On the 13 now.
Not, okay,
on the 12th, I went and sleep.
In
In the morning,
the next day,
the next day they came and prepare me, and then like, okay, let's wait for the doctor, okay? My operation is supposed to be at 11. They prepare me 11. They take me to the theater. Now we're in the theater. Where is the doctor? The doctor's still on the way.
Yeah.
I'm there. Oh, now they have to phone the doctor. Eh? Where are you? The patient is here. We're waiting. We all ready. It's just you. The doctor is like, no, I'm just here at the back. At the back way.
Where?
Government hospital. It's a joke.
What?
Okay, and then after some few minutes, the doctor show up. Then I was preparing everything. The operation starts. With C-section, you don't sleep. They just numb these parts.
Yeah.
So when you start cutting, I could feel pain. Like, yes. I'm like, doctor.
You're feeling the pain?
I feel how you're cutting. I'm feeling pain. The doctor say, no, you're lying. I'm like, why must I lie? I'm feeling pain.
Way.
Then, okay, continue doing the operation. The minute where I could feel even how he put his hand in me to grab the child. When he grabbed the child, now they have to put the child. I screamed because I could feel that pain. I screamed. When I screamed, then he was like, oh, the lady really, she's in pain. They take the baby out and then like, no, tell the aesthetic doctor.
Are you serious?
Yes. Put her to sleep. When they take the baby out, like they find there was blood in me. It means when I was pregnant.
You're having internal bleeding?
Yes. Which if they did maybe the operation on
the 11th?
Maybe I don't think I'm supposed to go through that because maybe they delay me and I was
can we please stop with the ignorance?
Then I just hear the doctor scream like, Jesus. Wow. The other doctor asked me, do you pray? I say yes, like you've got a living God. Cases like this, it's when somebody just die. Then just after to discover that she was bleeding.
Because internal bleeding is very dangerous.
Yes. They take the baby, now they start sucking out the blood. Well, meanwhile, they put me to sleep. They inject me that one, I can sleep. Then my husband,
did you get to meet baby before?
They took the baby, they show me my baby, and then because when I
can imagine you're not even in the
that time I was already weak, like want to sleep, because remember when they took the baby out, I could feel that pain. Then the doctor said no, inject her so she can sleep. Then they inject me once, then I'm going weak to sleep. Then they show me, here's your baby, did you see? I'm like, no, it's a boy. Okay. They take the baby away, and then I slept. They did what they did. I didn't know. My husband standing, see they pass with the baby. Where is the mother? The mother is not there. It took like I think 30 minutes or more than 30 minutes. So they finished, they put me aside. Then when I wake up, I'm like, I'm in pain. I didn't even know what happened. Then they say, oh, you up, okay. Let's take you where your baby is. So I didn't know even what happened. I didn't know.
They didn't explain to you like
no, nothing. The parts that I remember it when they make me sleep.
Even the injection that they gave you, it's supposed to completely numb you.
Yeah.
Which injection did they use that you still felt the pain?
I really don't know.
This thing needs to be investigated.
So when I wake up, I don't know what is happening. They didn't explain me nothing. They just took me and put me on the bed next to my child. Okay, I didn't know. Meanwhile, I was having this thing that they put a pipe in me from here. Okay, they open here. The pipe goes till the. It was the sucking the blood, the remaining blood goes in that thing. It was. I'll send you the pictures like this. And then I've got these sons. I've got drip.
There's so many things.
So I don't know what I was having. And then with everything that I went through, my child went through, the side effects were like negligence, because that thing when they come to remove, I don't know if they didn't, when they were doing the operation, I don't know really what happened. I developed infection after giving birth. And then it was really very bad because my stomach started getting swollen.
Yeah.
After the hospital, after I was discharged, I noticed that my stomach started getting swollen and it was very hard. So when I went to check up by this private doctor, it's like, oh, you've got infection. They have to admit you in the hospital. Like,
and the infection was internally.
Yes, was
like internally. Literally around her intestines.
So now, when I went to the hospital, the doctor who operated me was like, oh, they discharged you. I was looking for you. I'm like, okay.
Why?
Maybe they know what's happened. I don't know why.
Crazy.
So remember, they don't tell you. I'm like, no, I don't think they're supposed to discharge you. I was looking for you. I'm like, okay, I'm here. I'm not well. Okay, we have to admit you. They admit me. And then they say, no, let's treat you. Maybe you'll get better. They were treating me, but nothing. You know, it was like the problem was keep on
getting worse.
So now the option was like to do operation.
Again.
When they have to do the operation, now the doctor started running away. I don't know why. He didn't want to do operation on me. So there was this doctor. It was a young doctor. And really that one helped me a lot. So, and then, okay, my aunt called Dr. He went to talk to Dr. and check me. I was there. And then it's like, okay, fine. I'm going to send people to come and fetch you because, I'm going to the theater. Like, okay, fine. Ooh, people. You know, they refused to take me. They sent somebody else. Then the people came to fetch me like, no, don't take this one. No. Take this one. We give you this one.
No way.
So then the theater, they bring somebody else. You can't say no. You have to operate the person. And then his time was up. He has to leave. And me, I'm still have my problem. And then the doctor and check me like, oh, let me call. There was this Congolese doctor. He came, called that doctor and say, here's your sister. She's suffering. Please, I'm not gonna be there tonight. Since you're working night shift, help me operate this woman. That doctor said, oh, no, it's fine. I'm going to send people to come and get you. Gone. The next day, they find me in the same position. He said, you see your brother couldn't even help you. Fine. And then, now he was also scared. He went to call this Indian doctor and like, please, can you come and see this woman? The Indian doctor came and said, please, I want to help this woman, but I'm scared. I want you to help me. The doctor said, no, it's fine, I will help you. When they check me, say, there's something big that you have to remove. Now they start having this discussion. We must cut it like this. The Indian doctor say, no, like this. And then because the Indians say, if you cut like this, we suck out the pus, this woman should come back. There's something big that is grown here. We have to cut and remove. Okay, cool, tomorrow. The next day, they come take me in the theater. They start doing the operation. They remove. I don't know what they remove because they didn't show me. When I wake up, I just have this big cut from here to here. I don't even know because I couldn't even see it was closed. Okay, fine. Then the doctor came. How are you feeling? I'm like, oh, much better. First, before the operation, is in my stomach is swollen.
Yeah.
I'm sitting. I was the pain was unbearable. Like every time when I was even for painkiller, they'll be like, "You too much. Are you the only person who's feeling pain here?"
Yeah. Oh my God. Like how?
Like they can't even give me painkiller. Fine. One day I'm sitting. I just hear something burst. My stomach burst. Now there were pus coming out. You know. When I saw, I screamed because it was so terrifying. I just screamed. Then this nurse came and said, you always cry of pain. Let's see what is happening. When she just opened like this, she's like, yo, I'm sorry. I didn't know it was so deep.
Guys, let me explain the deepness of this. Her tummy literally opened up. I remember she sent us pictures and we lost our minds. We're like, there is no way they're ignorant to the person. I'm gonna insert the pictures over here. You guys, the amount of ignorance that they did on this woman, God loves you.
Too much.
First of all.
Too much.
God loves you because it was crazy. It was crazy.
So now this woman, like, she feel bad. She's like, no, what, I'm gonna help you. She went to call another nurse. Now they start squeezing the pus. Because I couldn't sleep. You know, even now I ask myself, how did I go through that with a baby? Because I was admitted with my newborn baby. How? I don't understand. But now I just say it's by the grace of God.
Yeah.
You know. So they start squeezing. So at least I can sleep. They managed to take out some pus. That day I sleep, you know. Okay, it's the next day that doctor came, they check, and the other day they came to do the operation. So after the operation, I asked the doctor, like, why did you remove? Because you guys were discussing like there was something bad, there was a big growth. What was that? In just few days after giving birth, something just grew like that. What is it? Like, no, it's fine. No, I'm like,
no, it's not fine. They have to tell you.
No, you don't need. I'm like, okay, can I at least see how big is the operation? No, you don't need to see. So I don't know why, but okay, it just was so big. They didn't want to show me because they knew that she will be scared. Okay, fine. The next day, after 2 days, the doctor sent the nurse to come and clean my wound. The nurse came, opened, lie down. She was busy cleaning, nice. Then she's like, check. Oh, it's lunchtime.
Oh,
it's lunchtime. I must go on lunch. Go to the last part. This is the first operation after giving birth. Like I had birth by operation, and then this is the following operation because of negligence, and then there was another operation because there was something grew big again, which they have to operate, you know. After that, before that operation, it was my child operation because I think because of the cold, it was affected. There was these things.
Oh yeah.
So my child couldn't even breathe. It was bad. So they operated.
So he also had to go through an operation.
And me and him, it was like, today hospital, me, I come out, it's him. When he come out, it's me. And then I have to go at the second operation. After the second operation, because it was bad, they found out that there was something that grew in me, a big growth, and then that growth was leaking water. That water was like a glue, and then put all the things inside, intestine and everything, all stick to each other. All this because of negligence. It was negligent. I don't know if it was the thing that they used to operate me that they didn't clean properly. I really don't know. Because like I wanted to sue the hospital, but you know,
I think you should have sued them.
It's hard because I went to the other doctor. I could see there was negligent, but he say, as a doctor, if I help you to sue the hospital, you know, things like that, you know, politics.
Yeah, they're also worried about their licenses.
Yes.
Yeah.
So I have to leave it, but now I have to talk about it. After that, they removed that growth. The doctor told me, like, you know what, this is not it. You have to come back again for a bigger operation. The second time when I went, the third operation now, it's where they have to remove all my intestine down. Clean.
Well, they took it out.
They have to take out and clean. Remove that glue was putting everything together. Remove. After that, they have to take out my womb, my tube, because everything was affected. The doctor told me if you leave me like that, they don't remove, it can give me, I can get cancer with time.
It's crazy.
Yeah, I will be like operation after operation.
I know you also mentioned that if you had to fall pregnant again, there's a big possibility.
They told me that I might not make it. Yeah. So it wasn't an easy thing. But thank God I'm alive. I went through so much that I always say this life, I owe it to God. If it was not for him, really, I wouldn't be here and speaking like this. I went through a lot, but I thank God because he's the master of everything. So it was bad. It was really bad. You know, all this because of negligence. The staff at the hospital, they are very bad. They, you know, I don't know. I remember once a doctor, a nurse told me like being a nurse is a punishment. You know, I asked her how. A punishment is a torture. She said it's a torture.
But she chose that same career.
She said like when you guys are sleeping as we're waking, I'm like no. You're the one who choose this career, right? Yes, but you choose it. Why did you choose it if you can't do it?
If you're not even passionate about it.
That is the problem. So it's not really easy. It's not easy. It's really bad. Nurses day, government hospital, it's not good. If somebody go to come out, it's by the grace of God. Most of the time, you hear somebody go, the next thing that person is not there. True. That is really, I had a very bad experience there. The nurses are not really friendly. They are just like, I remember once seeing the baby was just born now. This nurse is carrying the baby. This is the child. Tula wena, Tula. The baby is crying. They just come out of the stuff. Tula wena, Tula. Why? This baby is small. I don't know.
Out of words. Oh my gosh. We are just glad that you are alive.
Yeah.
We love you, and it's such a blessing to have you here speaking about this and encouraging all the women that have gone through this but never spoke about it, or women that are about to be moms. They need to know that this can actually happen in hospitals.
Yes.
So guys, please ask questions. Ask a lot of questions. Things that you don't understand, ask. If you feel pain, stop them. Because you don't want to go through something things where like now your family loses you and your baby stays there, you know. So we are so proud of you. You're such a strong woman. I always tell her, you're such a strong woman that you are here today sharing your story. Yes. She has 3 beautiful children that are so smart, and
you know what I can say, don't ever give up. Stand for yourself.
Yeah.
It can be difficult even when you go through hospital like that. Stand up for yourself. Don't let them put you down. Because if you let them, it's when people even you get to the point of losing yourself, losing your life, losing your
mind.
Your mind, you know. It's not easy, but don't give up. If you have to fight, fight.
Yeah.
Fight, because it's not easy.
Yeah,
government hospital really
it was so hard on our family because she was in and out of the hospital. She was literally in and out of the hospital. We're praying all the time.
And to all the nurses out there, to everyone want to be, if you want to be a nurse, you want to be a doctor, please check yourself. Can you do it? Can you deal with such people? You know, if you can't, don't do it. Don't do it because it's pay well, you're gonna have a job, you're gonna have salary. No, you're dealing with people's life. One mistake, you're destroying people.
That's true.
You know, you're dealing with people's life. If you feel like you can't, don't do it. Don't do it because it's pay well. Don't do it because you want to have salary every month, but meanwhile you're not happy at what you're doing. No, it's not right. It's not right. I know it's not an easy job, but if you choose it, really try hard, you know, than
they're making people have bad experiences. This is how people have postpartum depression. Like you give birth, but you're just not yourself anymore because now you have to deal with this new body that they've given you.
Like for me, it took me so long, you know. I wasn't well. I wasn't well. I was trying. I wasn't well. You know, sometimes I'll stand and start talking to myself like what is happening to me? Why? Because my mind was not okay anymore. I was traumatized because sometimes the nurse will come and say, I'm not going to give you medication. For what reason? I don't know. What did I do? I don't know. You know, that is not really good. You can't treat people like that.
No, you really can't. Yes. Oh guys, she took all the words out of my mouth. She couldn't have said any better.
Yeah.
So guys, if you know anybody who is working in the government hospital, please show them this video and just ask them like, do better. For me, I just want to have a nurse come here and actually speak that side of the story, because we clearly they all went to the same place where they teach them to be mean. I don't understand, but we need to also hear the side of the story. Alright guys, thank you so much for watching.
Thank you very much.
Thank you again to my beautiful big sister.
Thank you. It's so nice to share these things. So nice, really.
No, she's been wanting to speak about it for the longest time. She speaks to us, but I feel like the fact that she's able to share this awareness for all the other women that have gone through the things. So we are grateful for you, for your life and everything else that God has planned for you. You have your beautiful children, and that's what we are happy about. And you have a long life also. You're just 21.
Imagine, I'm forever young.
Forever young, literally. So guys, thank you so much.
Thank you very much.
Don't forget to comment,
yes, and like and share.
Yes, and subscribe.
Please share lots.
Please.
Women have to know about this thing. Women have to be prepared. Like when you go give birth, you must be prepared. Like, you know what, things can happen, but I must be strong with it. You know, I must be strong. I mustn't give up.
Hallelujah.
You know? Yes, I mustn't give up. I have to be strong, because things happen. When I was going to give birth, I didn't know such things like this will happen, but it just happened.
And you know what's the crazy part is that sometimes you can't really predict, because
you can't.
Like your first pregnancy was so smooth.
Yes.
Second pregnancy you had a C-section, but at least it was fine.
It was
the
fine.
Third one came with problems,
and the third one I was very happy. I was ready more than all my pregnancy. I was really ready. I was like, no, I'm happy to have my baby. I'm happy to go through this, but turn out like just like that. But
you really can't predict things.
Yeah, we thank God. All is fine.
So grateful. I had to make her stop everything to come to my channel. I was like, I don't care what you're doing. You are coming.
Don't worry. We'll talk about it. We'll talk about more.
Yeah, I'm just thinking to have more women on the panel.
Yes.
At the same time.
Yes.
So we'll see.
Yes.
Hopefully that happens.
Yes.
And do reach out to me, guys.
She'll answer all your comments.
Yes, I'll answer all the comments.
Yes.
And if
you've got question, ask her.
Yes. If you guys want to back on the channel, she'll come back.
I'll come back.
By 5 by 4.
I'll come back. There is more to talk about. I'll come back. I'll come back.
Thank you.